Mr. Patrick Muwanga but nsimye nnyo nsimidde ddala okuvaawo leero nja kuba njogera maybe mu luzungu ne mu Luganda ne service ya Luganda so mostly nja kwogera mu Luganda. First of Reverend Magala njagala okukulisa obulwadde n'okutegeeza nti tuli basanyufu nnyo okubanga tukulina leero Mukama yeebazibwe. Actually I think ekya inspiring okujja okwogera ku COVID I think mu community yaffe and kino twaki discussing back and forth ne muzeeyi ne tulaba nti maybe community obulwadde bweyongedde and I think the reason that is kubanga stigma Reverend yoshogeddeko and I think ne tuwulira nti maybe singa tuvaayo ne tutandika okwogera ku kino ekintu ne tukijjako stigma kiyinza okuyamba community neyongera okutegeera ate n'okwongera okupreventing obulwadde okusaasaana. Naye njagala kwebaza Mwami Muwanga okwarranginga ne Reverend Magala ne church at large okukkiriza maybe nfuna opportunity eno okudda mu community yange community yaffe contributing. I think that's the least we can do in times like now where effort is needed from whoever can contribute. I think it's best that we do what we can okugezako preventing this virus from getting even worse. Luckily tubadde na bantu betuluzinze, many of them betuluzinze and twebaziriza ekyo Katonda nti so far majority abakwatiddwa COVID mu community yaffe at least babadde bakomyewo and kituwa essanyu lingi nnyo okulaba nti at least tusobola okumeetinga leero waliwo ababadde nabo obulwadde ne baba overcoming and they are able to speak today. Example Reverend Magala nga bw'ogambye nti I think it's our job to continue to spread this. Now COVID ekintu ekiri ku COVID yali stigma and I think it's not a death sentence. It can be a 2-week ordeal. Abantu bafuna symptoms ne bagenda ne bawulira bubi nnyo and some people get severely ill naye nga si bwe bulwadde kwegamba bwe tubulemingira omulala nti abutuwadde and what I've noticed I think the question would be why now? COVID tubadde nayo okuva mu February. Why are we coming out to speak now? Great for our community before virus tebadde so rampant in community yaffe. And it's clear now that the virus has invaded the community. And it's even getting wider and more, taking more root. And I think it's time to really get a good talk about it and see how we can prevent that from happening. Ekiri ku COVID yalinga nga senyiga. It's unfortunate 80% bajja kubufuna bajja kusigala ewaka and they will just improve just like the word for flu virus. Naye COVID can be severe for some people, mostly the elderly. They know information about the TV all the time. Now I think the talk today chenjagala okufocusingako kwe kugamba nti oye naina ababufunye just pick up the phone okubira omuntu yenaina gobadde mu contact for the past 48 hours at least omutegeeze nti I've tested positive and ekyo kyekitegeeza si muntu kujajinga wabula omuntu okutegeera nti okay bwe mbanga mbadde exposed nja kusobola okugamba omulala oba we naba mbadde ngenda kukyalira Mwami Muwanga oba ngenda kukyalira Mwami Gundi maybe nsobola okwambala mask n'engenda yensobola omuwonya buno bulwadde kubanga the idea is even though toyina symptoms bw'ogenda n'oyogera n'omuntu oba n'obeera mu contact n'omuntu oyo omulala ye ate ayinza okufuna obwo bulwadde ate in most cases ayinza okuba nga alina pre-existing medical conditions oba nga mukadde over 65 years old ate yo obulwadde ne bumuyisa bubi more than you gwe abulina. Idea y'obutagamba muntu it might be a judgment thing. Omuntu ayinza gaweewo bwe nagamba abantu ne banjajinga ne bambulaminga nti nze aleese obulwadde. Problem eriwo nti bw'otagamba muntu oyo tomanya ate ye ayinza okukyalira family member of yours and of course mu community fena tuli ba Luganda so regardless ani gwakyalidde as long as community member ayinza omukyalira kuba yetamanyi nti yabadde exposed ate nga oyo muntu ayinza okubeera muganda oba muntu we nyini ate n'owulira nti ye bumuyisiza bubinya ends up in the ICU. So I think that's where the stigma has to go. Stigma jeva it's not even clear because really COVID is just like ogamba omuntu nti nina cough. Sure 20% by ending up mu ddwaliro. Naye 80% don't even go to the hospital. 80% bagenda kubeera obwezi wakaba bakole ebintu byennyini badde bakola ku flu virus babeere just fine. So I think and it's just a 2-week ordeal. It's not a death sentence. So okugamba omuntu I think that's the least we can do for our community members. I think that will be the best work okubukwata buganda spreading. So again I will emphasize this. Nti omuntu yenna testing positive not a big deal but the best you can do for the community is pick up the phone tegeeza abantu bonna bonna b'obadde nabo in contact for the past 48 hours, because it's believed that someone can actually pass on the virus or spread it at least 48 hours or 2 days before they present with symptoms. So just reach out. Obategeeze nti by the way na testing is positive, just so that person is aware. And when they're aware, they can decide whether to go test or not. They don't really have to test, but at least they know to take more strict measures, bagane passing on to other people. Again, COVID is maybe here to stay, but at least community affair now more than before. This season, but the heat so hard, and we are having people abantu abajjanga bali positive. The bigger issue here is the anxiety, because the information is not out there. Sure, information about the TV, naye badde ku TV badde overblown. That wochiraba, especially with twatandikira mu COVID nga yakajja mu January mu February, otunula ku New York nga dead bodies okazokaze boogerako abantu abali mu ICU. The truth is, at that time we did not know much about COVID, and maybe some of the things we did in the hospital caused most of those deaths. Maybe we could have prevented them if we knew then what we know now, but now we know better. So COVID is not what it was then. COVID is like any other flu virus. Only difference is it can be severe, and yes, some people can die from it. Indeed, omwaka we're losing about 60,000 people to flu virus, and the COVID has for sure taken 300,000 people, which is about 2% of those who get the virus. But I think just like flu, if we can only tell people what we are dealing with, and that support, omuntu okumanya obumanya nti mwami gundi abadde ne buno obulwadde kati mulaba ayogera buyisemu, that in itself is empowering and encouraging enough for that person not to be scared. Because again, anxiety is what is stressing people the most. Into someone alowooza muke kati wengenda mu ddwaliro, is what is going to happen to me? Is it what happened in New York? Bwe nfuna virus, oba ngamba omuntu nti ndi mulwadde, does that mean I've caused kwegamba tadde almost kugwentana? So it's really not the case. Again, COVID, the majority of people have had it. Tebabadde na symptoms at all. And I have a small PowerPoint that I'm just gonna run through quickly, but I just wanted to say that overall, COVID tumutegera better now. There's still a lot of information that we don't know. However, we probably don't even need that information now okuyamba community to stay safe. What's going to help most in community affair in community affair in Uganda, the only community that we actually have, is I think to be okay with it and know that COVID is here, and COVID is just like any other illness. Thank God it's only, for most people, it's only a 2-week ordeal, and that we can prevent this by, or help other people by being open about it, and let them know, and let people decide what they want to use that information for. So having said that, briefly, I'll share the PowerPoint that I have, and then I'll just run through some of the things that that I wanted to, maybe some information I wanted to give out. Now, as I mentioned, how is COVID spread? By now, I think we are all aware how this happens. Kubako TV chibadeko so much, but I just want to emphasize some of this information that maybe oliajuuli deku TV. Na again, the anxiety stays. Kubanga chibade tuchinaba kututukako, but now it's with us. So I think we really have to re-emphasize this information and drive it home, even though ibadeko ku TV over and over again. But maybe if it can come from us, fefe nyini our community, it might maybe make a difference, and I hope it does. So tuchimanya nti COVID is spreading from person to person, and that's not news. And asobola okugenda ku pets, but not vice versa. Luckily, bobango in a pets is not really, at least for now, it can happen the other way around. And again, it's through droplets. Omuntu waba ayogera oba bw'asiniizinga oba coughing, the droplets, as if they can go to, someone else can pick him up. And usually those droplets is expected to traveling us no more than 6 feet. So I think that's the idea with 6 feet. World Health Organization and some other places have talked about 3 feet, but really, at least there's more evidence supporting the 6 feet. So I think, again, we try to do the physical distance of 6 feet. Idea is by the time that droplets were to hit 6 feet, gravity, so it won't really get to the person. But in closed places, for example, parties or places as it closed, as you can imagine, air very circulating and blowing at the same air. So instead of the 6 feet, that can be prolonged. But discouraging closed places, more, at least better, more outside where air can just circulate better. Name closed places, the same air gets blown over and over again, and people can, even though they are further than 6 feet, they can still pick it up. Only that because it will be the air will be propagated and it will travel longer distances. And as we already know, some people can have it, but they're just asymptomatic. They don't have any symptoms, but they can still pass it on. And that's the idea about, if you happen to test positive, please just pick up the phone and let the people, all the contacts you've had, and let's just do this for our community, for community members. But again, over government, by the way, this happened, and so they can look out for those that have not come in contact yet with the virus. And of course, we're touching the surfaces, or you're sneezing, droplets is dropping up any surfaces. If you put your hands on that surface, then nose take up mumaso or that can bring those droplets into contact with the mucous membrane, and that could just cause the virus to be passed on. Now, symptoms is a virus between 4 to 5 days. So you get exposed now, unfortunately you won't see the symptoms until about 5 days. And some people, if they don't get symptoms the following day or the day after, they might think they're out of the window. But really, you're probably not going to see them. On average, they will start coming up. If you're to have symptoms, they will be about 5 days. But for some, it might take 2 weeks. And I think that's the idea with the 2-week quarantine period. And of course, as I mentioned, some people may never have symptoms at all. And as we already aware now, the symptoms are the fever, the cough, trouble breathing. Some people feel tired. So basically all the symptoms you would get with the flu virus, which is unfortunate for us because around this time in the year, we have flu and we also have the coronavirus. But because of that now, more so than before, if you have any symptoms that are similar to the usual flu, just suspect that it could be COVID. And if you intend to get tested, I think that's a good point to go get tested. It doesn't matter. You may come up negative, which is great, but at least if you're positive, you're aware that what you're dealing with is actually COVID and not flu. And should things go down south, to seek help as you should. Naibu Wanga testing told him aware. You might dismiss the symptoms as flu, and they might actually turn out to be COVID. So it's always, again, now there are so many testing centers, which is great. So if you happen to test positive, that's fine too. If you test negative, great. But if you're positive, that's okay. All that helps you is you're just aware of the status. And this is only going to be a 2-week ordeal. No big deal. For the most part, 80%, it will just be a 2-week ordeal. And even the 20 that ends up in a hospital, 15% will do just fine. 5% might go into ICU. And unfortunately, some people will be lost and have been lost in that sense. But at least majority do get over it just by staying home and doing the usual things they do. So in other words, it's just best to get tested and know what you're dealing with, rather than just staying home and doubting whether it's flu or not. And in the meantime, you're spreading it to other people. Some people have reported nausea, diarrhea, skin rash. Now, these symptoms in isolation may not mean much, but if you have a constellation of symptoms, you have more than 2 or 3 of these, then it's time to maybe think about it. And of course, for COVID-19, the most prominent symptom that if you have, this is most likely COVID is the sense of smell and taste. Once you lose those, at least you have a higher suspicion that this could actually be COVID. And I think that's the time for you either to get tested or just quarantine for 14 days. And for some people, unfortunately, these symptoms can go for months, especially those who have ended up in a hospital and stayed in the ICU. This has progressed to pneumonia, and then, of course, symptoms go further. And speaking of pneumonia, as most of you are aware now, because we are fortunate in the community that we have medical personnel, we have nurses, we have people working in the healthcare. So we have a lot of knowledge about these things. So I think we can, teach ourselves and also just teach each other just to make sure that we stay on board. These are just the clean lungs. And when you get the virus, when it gets to the pneumonia, the lungs will just be filled with fluids, as you can see, that it's hard then to breathe. And that's where the shortness of breath comes from. For the younger generation, people who are younger, they can fight this virus before it makes its way down into the alveoli. But unfortunately, the older people, and of course, as you get older, you're over 65, everything starts breaking down, so to speak. So it's harder for you to push on this virus. The immune system is getting a little weaker, but also just the muscles themselves to push this fluid out get a little weaker. So that's how some of the elderly end up on a ventilator because they can't push this fluid out and to start breathing well. So some questions have come up that how come some people get exposed and they don't have symptoms? And again, the idea is for you to get infected, the virus has to be in the right amount. Just like HIV, some people who take HIV medications, it gets to a level where the virus is so low in the blood that it can't actually be passed on. Same idea with COVID. Someone may test positive because the test, what it does is it amplifies the virus that is there, but the virus has to be enough to infect the other person. So sure, somebody you might have been in contact with may test positive, and you may never be positive simply because they didn't have enough to infect you. So again, the idea is that if someone picks up the phone and calls you, it's no need to worry. It may have been that case that maybe that person tested positive, yes, but the virus that I came in contact with was not enough to make me sick. And so that should be reassuring enough for you to know that this is really not a big deal. Again, that person just looked out for you such that if should you have any virus in you, you don't, instead of going over to see Mr. Patrick Muwanga or see Reverend Magala, you at least pick up the phone and let them know I'm coming over, or at least just cancel that visit for now until 14 days later. What that is going to do is going to protect that 65-year and older community member from having to deal with all this. Again, if you are not sure you got exposed, you could just go get tested, just to be sure. But you may decide not to get tested as long as you're willing to continue taking the measures like keeping on the mask, social distancing, and trying to delay making visitations like we usually do in our community. So in other words, you just have to act like you're infected if you've been exposed, even though you don't have any symptoms. Again, quarantine for 14 days. The idea is that some people take up to 14 days before they see any symptoms. The question has also come up about, okay, well, if I'm infected or if I'm exposed, how long do I have to stay? Before, the quarantine was 14 days, but now CDC has cut that down to 7 days, as long as after exposure, 7 days after you've not had any symptoms, and that you did the test 2 days prior to end of 7 days. In other words, 5 days after exposure, because again, as we said, usually it takes 5 days incubation period for you to start seeing any of these symptoms. So if you do the test after 5 days, that means that at least there's guarantee that you're negative, and then you can stop the quarantine after 7 days. And if you don't test and you've been exposed, you've gone 10 days without any symptoms, that's a good time to stop quarantine as well. But again, if you stop quarantine, you should always continue to wear a mask and social distance, because who knows, you might pick it up again, or you might spread it to someone else. So some of the treatment, and some people have asked about, what are some of the things I do when I'm at home? Again, like I said, COVID is just like the flu that we've usually had. So just do exactly what you do for the flu. If you usually take some Tylenol for fever, that's great. Continue to do that. The cough medicine, you can take that over the counter. The one that we should maybe be cautious about is NSAIDs, like ibuprofen and medications in that category. There's been some cases that do show that people who have taken them, they've also had a severe disease. Now, there's not a direct correlation between NSAIDs and severe illness, but just to kind of look out and make sure that that you don't overtake the NSAIDs or ibuprofen. At least use Tylenol first before you use ibuprofen. And if you must use it, just use it sparingly, knowing that it could have some consequences that we may not know about. And there's been a question about the isolation. Again, most of this information, I'm sure, it's been passed on, and your primary care doctors talk about it, and we've been watching it over on TV. But it's just kind of to bring it home and just, emphasize that this really works and that you can get through it. So for people who have tested positive, those are the index cases. You could isolate for 10 days. And, if you haven't had a fever in the past 24 hours, you can come out of isolation, and then you can start interacting with other people in the house. Some people have asked that, okay, well, if I'm at home and then I test positive, then What do I do for the family members? And indeed, as we know that in our community, we have big families. And if someone tests positive, there is that fear that you're going to spread it to your family members. And that's understandable to be anxious, but not to worry. While you're in the house, just continue to wear the mask. If you can still social distance. You can still you sit in the living room as long as you can be 6 feet apart. And that every time you are in contact with other people, you have the mask. Just continue to do what you usually do. Being positive does not necessarily mean that you need to hide. Now, the idea before, when the virus had just come, was to isolate. And isolate meant finding a separate room to be in. But that's not really practical. We have bigger families, and that's really not ideal. So instead of, if you can, you have an extra room and you can be in that room, but that's not really easy to do. And people haven't really followed that, which is okay. Just keep on wearing your mask every now and then whenever people come in contact with you. If you're all by yourself in the room, that's fine, you can take it off. But if you're with people, then you can just wear the mask and continue doing what you're doing. Just try not to share utensils. Just try not to share anything that saliva could be left on. Or if you to share anything, just wash it and then let other people use it if they have to. Otherwise, again, this is just like flu. It can still be passed on, but there are ways to prevent it from being passed on. And there are things that you do every day. You still wear a mask. So again, if to protect your family members, you should still wear a mask. Now, the question has also been, well, if I test positive, what then about my family members? Everyone in the home, again, as I said, that COVID is spread more in enclosed areas. And of course, being in a home, that's an enclosed area. And also, as I'll talk more down, is that the longer you stay in contact with that person, the higher the chances that you will get the virus. So because it's the home, chances are everyone in the home has been exposed. They don't have to get tested, but at least they will have to quarantine. They will have to presume that they did contact the virus. If they show symptoms and they want to get tested, that's fine too. But if not, it's just recommended to just self-quarantine, assuming that you do have the virus. But yeah, they do not have to get tested. It's not going to change anything. And, it's just been out there that, well, just go stay home. But some people have not really told us when do we then go to the emergency room if we need to? I mean, how do you know in the middle of the night that, okay, now I need to go in the emergency room? And some of those things, not a lot, but if you do have trouble breathing, that could mean anything. But specifically, for example, if you're just at rest, laying down, and all of a sudden you can't really catch your breath. If you talk to someone on the phone and you think you hear they cannot catch their breath, that they just cannot finish a sentence, that is time for you to know that actually, I think this is getting into the lower lungs and it's time to go into the emergency room. If someone has that severe chest pain, like pressure, then that is, again, another indication that maybe this is more severe than you expected. People with blue lips or a blue face, that just means that oxygen is really at its lowest levels. That would be time to go in and make sure that your oxygen is reinstated. For kids, there's a complication of COVID, and one of the symptoms, as I will talk about down below, is that severe belly pain. And now, of course, with COVID, as I mentioned, diarrhea is one of the mild symptoms. That pain might be different, but there is this severe belly pain as if you have appendicitis. For those who have had it, that is the kind that will at least be an indication to go to the ER. And of course, if someone acts confused, you're trying to wake them up, they can't. That means that that is time to go to the ER. So really, basically, these are really the most concerning symptoms that you look at and say it's time to go. But short of these, just having some shortness of breath here and there, if you're trying to walk or trying to go up the stairs, that's expected for someone who has a flu or any kind of virus. So that is really not cause for alarm. But these main ones are the ones that you want to call and see if you have to go in. And of course, if you're going into the emergency room, it's always best to call ahead of time to let them know. That way, by the time you get there, they're ready to go. But otherwise, like I mentioned, 80% don't even get this. Only 20% will get these kind of symptoms and end up in a hospital. So again, COVID is not a death sentence. COVID is just here to stay with us. COVID is just like a flu. It's a 2-week ordeal. Just know you have it. Know that it's just like flu. You're going to treat it as such. For most people, of course, some people, it might get to this and that will be unfortunate. But for the majority, life goes on, but at least just know not to pass it on to those who it might actually turn out to be severe. Uh, and the question has always come, who are the people at risk? And this has been said over and over again. People who are over 65 years old, again, as I mentioned, their immune system is lower. The body really starts kind of slowing down when you get a little older. So that is why. And people have some heart diseases, people with chronic kidney disease, type 2 diabetes, chronic obstructive disease, sickle cell disease, people who are obese, and some of those who have some immune system issues. People who have HIV, some cancer medications can cause that. Asthma, cystic fibrosis. And some people with blood pressure too can be at risk. But again, you play it by ear. Just because you're 65 does not automatically mean that when you get this virus that you're gonna break down. That's not true. You could be 65 and still just be well and not even have a single symptom. So again, I think it's just staying positive about this and knowing that God willing, you won't be in the selective few that end up getting the worst of this. But otherwise, we've had, people who are over 65 and they had the virus and they did not even show any symptoms, which is good news. The question came up about the false negatives. How come when I tested yesterday, my test was positive and I'm in negative and I'm testing today, it's not? The idea is that with that is that we do have different tests as it's been broadcast on media. Some tests do test for, the most accurate one that we use is the one that tested the genetic material. That is the nucleic acid test. That is the confirmatory test. But there are tests that are looking for proteins, the antigen tests. And these are faster. They come back faster than the, but really they are less accurate. So that one is negative, and then you're going to get the nucleic acid and that might be positive. That's one reason. But the other reason too is that depending on when you are exposed to tech, as I mentioned that the incubation period for COVID is usually 5 days, meaning if you check a day after exposure, it might be negative, but that would be false negative. What that means is that you check too early. The virus has not multiplied enough for the test to pick it up. So some people may want to repeat it maybe after 5 days, but if you have a high suspicion that you could have COVID, you don't have again to wait for the test. Just act like you do. Do the 14-day quarantine if you must, and then you're done with the ordeal. Otherwise, if you test after 5 days, chances are, if you are indeed positive, the test will pick it up. But that's what brings in the false negative and the negative tests when indeed you're positive. Is because one, you might have checked early. Two, you might have been exposed, but as I mentioned, the virus was not enough to make you sick. So indeed, you're actually negative. Or three, the test that has been used. If it is the antigen test, then it's not going to be as accurate as the nucleic acid. So that might explain why you've been negative. But not to say, well, this doctor lied to me or this or that. Again, it's because there are these things that have been happening and people get frustrated with it. And again, the question which I've already answered is that why some people get exposed, but really they don't have an infection. As I said, to be able to transmit this virus, it takes a few things, three things maybe. The type of exposure. What kind of contact have you been in? Is it a close contact less than 6 feet? And the duration of the exposure. How long have you been there? Some people believe if you've been in contact for 15 minutes, that's at least the minimum. Otherwise, if you just pass by someone who has COVID, that's not enough to give you enough. But imagine if you've been seated with someone for 30 minutes, they've been talking constantly back to back, you don't have a mask on, you will get enough presumably you'll get enough of the saliva that the droplets will be enough to infect you. But otherwise, if it's just a quick contact and you're gone and it's been farther apart, probably you just won't be infected, even though the person that you were seated with did have the positive result. And of course, some people use masks and social distancing, which are the preventive measures. You will be negative even though you were exposed. And also, again, it depends on the person. Like I said, some people do have a lower viral load that even if you were exposed to them, it's not enough to make you sick. Now, it's clear now that children usually don't pass it on as adults do. We don't really know why that is. Maybe they just don't have enough viral load to infect, but it's for the most part, children rarely pass it on to adults, but adults can pass it on to children. So that's just something that there's been case reports for it. It's not clear why that is, why children usually don't pass it on. But these could be some of the reasons why that is. And again, with prevention, as we've said, social distancing 6 feet apart, which in a home environment, that's not practical. But at least wear a mask. Whenever you are in contact with people, try to do that. Wash your hands as much as you can. Now, disinfecting, again, this is transmitted by droplets. That if those droplets with the virus in them drop somewhere and you put your hands and then you bring those hands into contact with your eyes or your mouth, anything with the mucous membrane. So there are disinfectants. Most of the disinfectants in CVS or Rite Aid do say kill 99% of the virus. Some of them are just for bacteria, but some of them are for virus. So you could, just get those. Research says that at least this virus, if it's not disinfected, it's at room temperature, it could stay, it could last as long as 6 to 7 days. But if you use the disinfectant, that could kill it in 1 minute. Or if it's exposed to the sun, higher temperatures, that too could maybe 15 minutes, it's gone. But if it's at room temperature, just like in the house, they could stay as long as 6 days. So using a disinfectant and kind of wipe up the tables and doing all that kind of stuff, I think that's not a bad idea. And of course, avoiding traveling if you can. Otherwise, if you travel, again, adhere to those restrictions. Question has come up about the vaccine. And of course, the vaccine is coming up and hopefully people in the community, majority will be thrilled to get it. People that should not get it, at least by now, what we know is that those who have a severe reaction, an allergic reaction in general that has been so severe to anything. There's been some cases where those people have actually had a bad reaction. Otherwise, and of course, people who are pregnant, and you have to discuss it with your GYN. But for the most part, it's a safe vaccine. It's made differently. And it's been tested in people over 16 years old, and it's been relatively safe and effective. Those who are under 16, trials are still going on. They were not part of the trial, but at least those who are older than 16, not pregnant, and they don't have this allergic reaction, it's relatively safe to take. So I would encourage people and recommend that when it comes, you do take it. Again, the way this virus is made, because there were questions before, because some people got the virus and that virus gave them the infection. I mean, they got the vaccine and the vaccine gave them the virus. There are vaccines that were made in the past that they actually got the real virus and used that to inject a lower amount to inject into the body, and then the body would react to that. So that ran some risk of causing the virus. In this case, this vaccine, the way they made it is they just got the genetic material over an envelope of the virus, not the virus itself, but just the envelope of the virus, which should not cause an infection in itself. So that's what they used, and that's what the vaccine is going to be about. So this vaccine should not cause the infection itself. And of course, in our community, hopefully we'll get herd immunity, which literally means enough people have been vaccinated that, finding someone who is not, that can pass on the disease is rare, because the majority have been covered. But again, getting the vaccine, you can still carry the virus, you just won't get sick because you are protected, but that should not stop the droplets from getting into your nose. And when it does, you can still pass it on to other people. So those who are not vaccinated can get infected by a person who is vaccinated, even though the vaccinated person cannot get it. So again, when you get it, you'll still continue to wear a mask, you'll still continue to maintain social distance until we get to that number that is enough that majority have been vaccinated, whereby 80% of the people you come in contact with are actually vaccinated. So even if you pass it on to someone, they won't get sick if they're vaccinated. At that point, that's when we take off the masks. But until then, I think we are still adhering to the masks and everything else. For pregnant people, again, COVID, when it first came in, we did not know how pregnant people would react to this, and we got scared, and it was an ordeal. But it turns out pregnant people get over it as well, just like any other people. The risk of them getting a severe illness are higher, but only relative to their age mates. Otherwise, it's just the same as everyone else. and the baby is safe. There's been some cases where it's been passed on to the baby in the uterus, but those have really been a few cases. And even then, the babies don't really get severely sick if that happens. So sure, pregnant people can get severely ill because of a lot of things going during pregnancy. But mostly people who are over 35 years or older, people who are obese, people who have high blood pressure or diabetes, just like the risk factors that are in the community, in the rest of the group. Otherwise, they are not at any higher risk of dying from COVID than regular people. So you can be pregnant and get the virus, and you can get over it just like anything else. And children, again, they at a lower risk of getting severely ill, unless if they have pre-existing conditions. There are those who are born with heart defects and everything, other medical conditions. Those can still be at a higher risk, but otherwise, the children will just get over it. They will just get a cough here and there, just like any other flu virus, and they will get over it over time. Now, the thing with children is they have a tendency to just have a sudden decline, that they could be doing well for about a week, and all of a sudden they decline. So at least until after 14 days, but before that, after a week, it's good to still look out. Even though they've been doing well, they're playing. Again, if you see a kid been playing and now is not playing, they have shortness of breath, just like in the serious symptoms that we talked about, I think that would be time to contact their physician or take them to the ER. And some complications in children, the most important one they've talked about is that inflammation that happens throughout their body. That cases have been written about, where most of the organs get inflamed. And some of these symptoms are, for example, if a kid has a fever that does not go away for 5 days, I think that would cause you to wonder. And just like any other time, you would probably want to take them to the ER. The belly pain, severe belly pain that I talked about, that is one of the symptoms that we see. And of course, if their eyes have that bloodshot look, the headaches that don't go away, again, they are irritable, extra tired, they can't wake up. And some swollen feet or hands, that is also another reason to suspect that that complication from COVID has come up. But again, this is rare, and most people won't get it. It's like 2%. So overall, and this is the end of the slides, but really what I wanted this talk to be about was to say that, again, COVID, even though on TV we've watched, and this was even the beginning, it's not happening anymore. We've heard people talk about the ER, talk about the ICU, as if it's this death ground. It can be, but it's not different than all the other cases, other illnesses that have killed people. This kills faster, this kills unpredictably, but again, only 2% do go that far. Majority will be okay. But what is going to prevent that from happening is making sure that we look out for each other. And what that really means is, let's stop with this shame and who gave it to who, because again, this is why this is a pandemic. What that literally means is it's all over the world and different people passing it on. You don't even know who passed it on to who. You could think that someone would judge you and think that you're the one who passed it on to them. And it could be that actually it's them who passed it on to you. So because of that, because everyone gets it, because everyone can get it, because it's not a death sentence, because it's the only way we are going to prevent it from spreading throughout our community, or at least look out for each other, pick up that phone. Whoever you came in contact with 2 days prior to your symptoms, just know, because that it's clear now, at least clearer, that someone can spread it 2 days prior to them having symptoms. Whoever you were in contact with, if you can reach them, please, please, please. No shame in this. Just like you would call them and tell them you have a cough, it's exactly the same thing. Just call them, let them know I was exposed, but I'm doing okay. And that will just help them to look out for themselves. If they have any symptoms, then they can go test. If they choose not to go test, at least they will cancel that planned visit for Christmas, because then they're going to spread it to someone else. It's really, really important. There's no shame in this. And after 2 weeks, they can then call you and say, how was it for you? If they know a family member or a friend who has had it, then they can say, so-and-so had it. They didn't have any symptoms. So-and-so had it. They did just fine. Or they did A, B, C, D, E, and that's okay. That's the only way we're going to bring down the anxiety. But we have to do this. As a community, we really, really have to do this. When I heard about our community having this as for this, winter season, that the virus is really so rampant, and that's when, as I mentioned, I talked to my dad, and we discussed and said, can someone, at least one of the community members, come up and do this? Because it's really that's what is going to help us as a community. One, to reassure people that you can get over this. I've had it and I'm better now. I did not have to do anything. I just stayed home, did everything I do. I just isolated or and things were fine. Just someone to hear that is enough to calm down the anxiety. And if that happens, people won't even probably be going to the ER. Because in most cases, people feel the need to do that because they don't know what to expect. Those who have had it have not shared with them. And so you can understand why that can really be something. And again, as I'll continue to emphasize this, just pick up the phone, call someone, let them know. And if someone calls you and say, we heard that you had the virus, sure, yes, I did, and I'm doing well. Thanks for checking up on me. And I hope that, you get tested, or if you don't, at least you know that the virus is in the community. Otherwise, the whole community is going. Everyone is going to have it. But it's not a big deal. Let's just do what we have to do and make sure that we stay on top of it. Thanks, everyone. And if there's any questions, I'll be more than happy to answer them. But I hope that this, helped and maybe to kind of clear the air that sharing the information is really important. And you don't have to hide because it's not your fault that you did get the virus or that you tested positive.
That is a question. You talked about the kids. Okay, the problem we have with some of the kids, they never tell you exactly what they feel, and you don't know what to look out for. I'll give you a good example. My son recently went for a long walk. He doesn't tell me. He gets out at 6 a.m. He walks like all the way, for you who know Canoga Park, from my home all the way to Mason Park, and then he comes home and he's walking like what is going on? Oh, my feet, they are sore. I'm like, so I started getting scared. And then I'm like, what happened? So then after he says, I took this long walk. So now you don't know if the sore feet are from the long walk, or like, because you just mentioned like swollen hands and feet. Well, they weren't really non-swollen, but he said they were sore and he was soaking his feet in the water. So how do you know? That's question number one. I just want to bundle them. I don't know if you remember. The other question is about masks. We've had all these categories of masks where they say these masks are not effective at all. Some of us are wearing these cloth masks. Recently, we had this funeral of one of our community members. And everybody was like, everybody went to that funeral, you're sick. There was that alarming voice, and the way actually our community members communicate is very alarming. We should have a better way of communicating. I wish you talk about that. Yes, there's a better way of communicating without scaring people. But someone calls you, hey, what a good day, you know what? And then it's so scary that instead of thinking of going to the test, now you're just like, oh my God, maybe I'm sick. So maybe a better way of communication also, and also not going spreading rumors. What a good day, so and so is sick. That's a problem we have in the community, but that's not an issue. I just wanted to throw it out there. But masks, how do you know which masks are good? Because we're told that some of these cloth masks are not good, and many people like at that funeral were wearing masks. So what happened? That's one. Those are the main two things that are concerning me. How do you know how to tell a child is sick? And how do you know if the masks we are wearing are good? Because they may not even be helping us at this time.
Right. Thanks, Judith. Thanks so much for that. Yeah, again, like I said, it can be challenging, especially for the kids, because they can't really explain what they are feeling and what happened. They can't give you the whole story. But the good news is, again, for your kid, at least he had a reason because he walked that long distance. And maybe that is an explanation why the feet were sore. But I think the most part is really to look out for the shortness of breath. That's the most one that you will be able to pick up on. If the kid talks and they can't even finish a sentence, they have to catch a breath to finish a sentence. That should be an indication for, a cause for concern. Feet being sore, sure, that's one of the symptoms of the complication, but it in itself in isolation may just be that they've just walked. And also people with COVID, some cases have had, a rash on low extremities or on their feet as one of the symptoms that match up with COVID. As far as the complication, you know, the swollen legs will be clearly swollen, not just sore, but you'll see that they are swollen as if they have fluids in them.
Okay.
That rarely happens. But if the kid walked and the feet are sore, I would assume probably that's because they walked. But otherwise, for the kids, it can be tough. But the best way to know is if your kid is sleeping, you try to wake him up, they can't. Just like any other time, you would be worried. If they are coughing and it's beyond the regular flu, where now they can't really speak, they're not eating, that's of course a cause for concern. If the fever is not going away after 5 days, you're treating it with Tylenol, but it's not really doing anything, that is a cause for concern. The abdominal pain or the belly pain will be too severe that even you'll be able to see that, okay, this is beyond the normal abdominal pain it is. So those symptoms, when they come, they will be more exacerbated. As far as the masks, you're right. Some rumors have come up. The cloth masks are not that effective. The idea is really to prevent those droplets from getting into contact with your nose. And some people have suggested a double-layered mask could work. Personally, I just use a regular cloth mask, and I'm fine. My belief is that the chances of a droplet coming to the mask and going right through it are really minimal. So again, the surgical masks and all that, there was a shortage, so that's why people could not access them. So they left those for the healthcare personnel. But if you can get one of those, great. But if you can't, a cloth mask is working just fine. You know, if it's double layered, great. But if it's not, better than not. So you're safe with that. As far as communication in the community, and I think that's why we are having this talk. It's okay. Well, I take it back. It's not okay maybe to have COVID, but it's okay that you've tested positive and you don't have to beat yourself about being positive. And if you've been at a gathering and someone has tested positive, I think it's just, again, just picking up the call and say, by the way, there's a chance that you might have been exposed. That's all someone needs to know. And then that person decides whether to go get tested or not. But just because you've been exposed is no cause for alarm. You may never even see a symptom. And also you may not even have been infected. Again, depending on how far you are from the person and depending on how much, in terms of how much viral load they had in their secretions that you got in contact with. And even if you test and you're positive, you have no symptoms, you got nothing to worry about. You're doing just fine. Once those 14 days go, or 10 days now, you are outside the window for the most part. So now community members, as far as going around and talking about somebody had the virus or not, unfortunately, we cannot, you know, tell others how to behave. It would be best if they did not do it in a malicious way. But, you know, people are people and they will go around and do what they have to do, even though you mean well. So that is something that we may not be able to fight as a community, but as long as you've done your part and informed those people you've been in contact with, I think you would have played your part. And those who go around and talk, I think it's just on them. And at the end of the day, they'll get to appreciate what you've done. Hopefully it turns out to be that way, but it's unfortunate that, you know, people talk and we can't really change that.
Well, it's sorry, I forgot one question. After the 14 days, people are free to just go out. Are they out of it completely, or do they have still something they can transmit?
So now, after 14 days, it's believed, or at least after 10 days, it's believed that you have had no symptoms. The chances of you passing it to someone are really minimal. So after 10 days, probably you won't. But again, after 14 days, even if you're to go out, you could still get reinfected if you didn't have, especially if you didn't test and you don't know if you really were positive or not. You might have assumed that now I'm okay, I've been exposed, that you did not have it, and you get reinfected. So again, you're okay to go out, but you just continue doing what you're doing, wearing a mask and doing what you do. The other thing that does is that should you, even though you've been infected and now you're immune, because there's some kind of immunity at least that you have, that now you're immune, you can still have the virus in your nose. For example, if you came into contact with someone's secretions, you yourself won't get sick because you're immune now, but the virus can still be at the back of your nose. So you can still pass it on to that person who is not. So that's why you wear a mask, not to protect you in this case, then to protect someone else. That's where that idea comes from. But also there've been cases of people who have tested positive until after 3 months. Even though 14 days, it's believed that maybe you're not infectious, but you can still, the test can still come up positive until up to 3 months. So just wearing a mask to protect other people, I think at that point, that's what you're doing. But you're okay to go out and do whatever you want as long as you can wear a mask.
Thank you. Thank you.
No problem.
Mami Nelson. Mbadde njagala okugattako ku kyoyogedde wano mu California tulina kye bayita California Department of Public Health.
Yeah.
So part of the breaking the chain of transmission, tulina your quarantine, tulina isolation. Last week, I think it was December 10th, they rolled out a new tool. It's called notification, exposure notification. So abaina iPhones or abaina Samsung, download the app, and before the end of today, I wish everybody can register their phone. Kubanga abadi infected, bagenda mu ddwaliro, bagenda kwayo their cell phone, so that the contact tracers and the investigators can contact them and get the contacts. So right now, today, what you can do to add that extra layer, okubeera nti registering okusobola ki okufuna ezo notification. Obeera oli exposed to somebody who is has tested positive, it will let you know discretion without exposing the person's personal information. So that's another tool, or that tool that you can do. And Zoom, so with a cell phone, you can add it to, you can download the app, and statewide it will be beneficial. Also,
can you put it in the chat, please? Can you put it in the chat what we download or something?
State of California, where is the app? Yeah, where is that notification for Thursday?
It has been sending it to the phones, but some of us have been ignoring it.
Yeah.
I'll try. So, I'm supporting the state of California. It's our home state. And if we can at least break the chains of transmission, Dr. Nelson pointed out isolation, quarantine. The third tool will be notification. So,
yeah. Actually, yeah, yeah, personally not signing up for that. So if I ever come in contact, I'll be notified. See California and Maryland. It is a great tool, and it will probably do exactly what we are talking about, lifting up the phone and call someone. But signing up for the app is great. That way, at least you never know who you've come in contact with. Thank you so much for supplementing that.
Dr. Katindo, information, no? Yeah, 2 weeks ago, has it been 2 weeks ago?
Yes.
Yeah, twa traveling ako.
Yeah.
Just yesterday, airline generamu yatugambye nti 2 of the passengers but testing up positive. Yeah. So we have tubadde mu quarantine. Today is the 14th, I think, 14 days. So far we don't have any symptoms. Tubadde bubi naye mpuliranga I wouldn't like to go and test to make sure. I want to stay positive until sabeera contaminated. How would you advise me about that? Should I go and, and get tested or ninde ndabe?
Yeah, no, so you've been in quarantine for 14 days. Chances are you're outside the window, so you probably won't get symptoms and you'll be just fine. Problem with testing at this point is that even if you tested, your information may be just so that message, but as I said, some people tested positive for about 3 months. So even if you contracted the disease, the virus, you might still be positive until up to 3 months. So, but that does not mean that you can pass it on to anyone. After 14 days, it's believed that the viral load join is so low that you wouldn't even pass it on to people. So, at point government, now you don't have symptoms, you don't have anything, you don't have to get tested. If you went and got tested and it came back positive, it is in one of those cases where you cannot infect anyone. You yourself cannot get infected, you're probably immune, but you're positive only because the test is so sensitive that it picks up cases that are viral load is so low that it will still show that, but it does not really mean anything. You will probably add up to the numbers, nebaga California to inakati, but what wade na chikumi katu ina chikumi mwem. Nayenga, as for you, getting attested may be chikuwano kugamba, okay, mazomu mufuna kata, I don't have to worry. Or that mazomu mufuna kata, at least manyende immune. That might be the only thing that you might get out of it. But otherwise, as far as preventing you from passing it on or having to quarantine again, you don't have to. You've finished your quarantine period and you're doing fine. Well, yeah, no, I hope that answers the question. Yeah, otherwise it's only gonna be for for you to kind of maybe okubeera assured nti namaze obufuna kakati nawe nobeera one of those people mu community abagenda okuwa abantu your experience, but otherwise you could be positive and that won't mean that you can still pass it on, so you're safe, you're not going to pass it on to anyone.
Bannange nze njagala kubakubiriza.
Thank you.
Musabire families, musabire abaana b'abannammwe. Kubanga Katimbo yajja wano juzi kavudde Uganda kati daktari. Kati mwaba mbasabira. Katonda ajja kukola ebigambo ebyamagero mu komite yaffe naye musabira abaana b'abannammwe balaba temutunuliranga butunduzi ne mulera ne mukola muki. Pray for and with them.
Nze mutubiranga akuba endongo nanze mumanyi oli akuba endongo.
Nze namuguliranga St. Mark's akole.
Nalingayo.
Ne Nairo Sport si church yokwa ne Nairo Sport bandipotingiranga nti agenda ekironga simanyi naye kyembadde njagala okwogerawo kyembadde njagala okwongera ku issue gyayogedde nti ekintu kino ekya COVID-19 ereme kuba death sentence. Naye nga bwe tugambye nti method of approach bannange yereeta bino byonna mujjukira mu Bayibuli Yokaana Omubatiza mu ndagaano enkadde bwe yayogera ku Herodiya mukazi ono malaaya bityo bukosi yali amwogerako kyali kituufu naye method engeri gye yakitwalangamu abantu kyabakola bubi naye ne kimukola bubi ne kimunyiiza era enkomero ya byonna.
I've never looked at it like that. That's interesting.
Bamutta naye ate mu ndagaano enkadde tuyinayo kabaka Dawudi ne nabbi Nasanayiri. Kabaka Dawudi naye yakola ekigambo kye kimu ku Taala Yuliya naye n'abeera mutambuze naye kabaka Dawudi engeri gye yagamba nabbi Nasanayiri engeri gye yagamba mu kabaka Dawudi yali ngamba nungi munnange wansi waliwo omusajja mugagga nnyo ayina ente 10 naye akyazizza omugenyi wali kubbali wabadde omusajja ayina akatekamu n'agenda n'alagira akasajja akatekamu ne bakamubbako ne bajja omusajja ne bamukuba n'okumukuba akataako n'akasala n'asanyusa abagenyi be. Kabaka Dawudi mujjukira kyaddamu n'agamba omusajja oyo ali luddawa ate nga ye mugagga n'ajja ku musajja abadde akabuza akamu namwe nedda ssebo nti oyo mbadde ngamba ggwe. Abakyala bonna bali mu Yerusaalemi baba ekyakututte ku Mukayuliya omukazi omusajja omu kiki kabaka n'akaaba. Kale no method of approach nti si kibi okutestinga positive ne stigma gye tugambye kakati oli alaba nga death sentence Katonda wange oyo mubbi oyo akoze eki kale nno nti ndoze ekigambo kino kitwale bulungi nti kwegamba nti abantu abamu kibatiisa n'okwogera abamu kyekibatisa okugenda mu church n'okwenenya kuba bwanayo nagabani abakristo babaga kugenda ne wenenyeza mukama bw'oyime n'ogabana nze nabbi enko ya gundi naye ansaba nsonyi eyo stigma ogenda kubeera mubbi paka lw'olifa. Kale nno nti ndoza method of approach naye tuleetera okuba n'omusango ogwo kati mukyala yigataganye genda kwetestinga kubanga takyagala ayagala amanye ne bwe yategedde naye bw'anaavaayo n'agamba ndi positive Katonda wange vale yonna ajja kubanga zizza omusango. Kale nno nti nze kyendowooza nti tufunenge gye twandolingamu ebintu bino buno bulwadde ate bannayuganda mu nsonyi we kino nyina okukibategeezaako maybe twali bana okumala tuli kumpi kumala nti ate bwe mulaba ekirungi temukyogera nnyo naye ekirungi omuntu kulwala muntu kufa ekibuna ene weeresi naye kati nga Reverend Magala bwagambye tuga nti omwana wa gundi kakati estate atone ate mukwata ku ttama kati kale bannange kiki lwaki kyo temukyogera nga bwe mwogera kiri kale no banenze kyenvudde ngamba nti okay bwe tuba tusazeewo si kibi okuwa muntu information bwe mumanya nti Muwanga mubbi Muwanga mulwadde togendayo kubanga ajja kukwasa obulwadde fine naye tokitwala mu ngeri yako ki bakita kusavuwaza oba kwegamba kukireeta mugundi kyogere mu bulungi kino kibadde bwe kiti kwegamba ekyo kyetugamba kuba buli kigambo omuntu one bw'abanga yafudde nga mubbi naye nga omwana gw'omuzaala bano ne bajja okukaabirako naye omuntu omu n'awakomera agamba agabbi nago bwe gayitiridde owulira otya sidde omwana yadde gw'omuzaala how would you feel yadde mubbi kale no kyenvudde ngamba nti tubeere very careful comments ze tukola nti abamu ze zibatiisa okuvaayo ne boogera abamu ze ziba Muwanga lwamukuteye bwakidde okwenjeera owagundi aliwo nga si issue kale nno n'olwekyo kyembadde ngamba nti stigma eyo tuveemu ne stigma yokka engeri ekintu kyadressingamu twadressinga ekintu positively kiba kirungi tutadressinga bulungi bwakyo bwe kiba mu bubi tukikwate n'obwegendereza okulaba nga information etuuka kubanga information eyinza okugireeta nga nnungi nate neefiira mu kkubo kyembadde njogerako ekyo banemwe bali
basawo nenyabo mbadde balamusizza amanya gange Florence wano Sebanda Clay munansonyiwa obutabeera ku vidiyo wendi sobola kubeera ku vidiyo ntuusa okwebaza kwange eri Dr. Nelson webale nnyo sebo webali ddala mukwano tweyanziza nnyo ate twebaza nnyo ne mwami Muwanga olw'ensonga eyo okutuzaalira omwana nga Reverend bwatugambye wamulabirira bulungi n'omuyigiriza kati ffe tubenefitinga tweyanziza nnyo tweyanze sebo n'ennyabo
Katonda yakola ebyo sife
kati pointi zange ziriga mwami Muwanga okwongerezaako ku kyoyogedde eky'abantu okubeera nti nno balina okumanya engeri ki gye baba bakomunikatingamu ebigambo ebimu abantu bagundi baffe community yaffe engeri gye bajjamu biba bisongovu nnyo ne bibeera nga bireetera abantu okubeera nti no they shy away from the right information and what they're supposed to do, the right thing to do. For example, nze nalina patient gwe naliko nengendako like frontline kati yasooka gwe twali tulina mu community wana abasinga mwamanya my brother-in-law kati bwe twagenda basooka ne bayita banurses abali around nga tebalina muntu n'omu asobola kugenda so nagenda nembeerako ku front okumala ennaku nga 2 naye abantu babuuza olw'okuba batwateeka ekifaananyi ku platform twakiteeka kabuye Haruna yakiteekako ne bateeka ekifaananyi nga of course we were like dressed up nga twekavarenze bulungi so I had so many people calling me nga baagala kumanya bane tukole tutya abantu batugambe balwadde mu community nengamba is true naye abantu abamu bagenda ne bawa comment embi ennyo ne bagamba oyo omukazi oba nurse kyoyo ayinza atya okuba nga aliviringa ayogera abantu nti balwadde omuntu yaŋŋamba nze Florence ne mugamba nasooka kiwulira ne ŋŋamba asijja kuwulira kintu kyonna muli bulungi naŋŋamba ne Florence kati bw'oba totubuulidde lwaki totubuulira kubanga ffe kati tulina abaana olina otubuulira n'otudefendinga ne mugamba exactly gwe wennyini gw'ombuulidde omuntu yayogera ekyo nti n'angamba nga yasooka kumbuulira negative news about me ate n'amala n'ambuuza ye kennyini mubuulire kati ne mugamba kati okiraba the same way nga bwe ngenda okubuulira to protect you is the same way I was telling other people abambuuza to protect them naye lwakuba oli yayogera nawa statement mbi nnyo about me and about my nursing and how I conduct myself ne mbagamba you know the rules of HIPAA naye waliwo ekituuka ku COVID kintu kirala kati ennaku zino kirala nnyo tulina creating awareness abantu basobole okubeera safe so that was like a gundi kwongerezaako question yange Dr. Nelson I heard ndabye cases nyingi nnyo whereby abantu babeera exposed re-exposed bemala okubeera babeera nga bafuna dda babattlinga they battled COVID before and so when they get they say that they develop antibodies and once they are exposed with people around COVID like that time they don't get sick actually and I have seen so many examples of people that they don't, they've been in a group of people like 5 people will get infected except them like 2 people and when you ask them they already had COVID. Does it mean that people develop antibodies and they will never catch COVID again or what is the period of time a body one can keep with antibodies in the tumanye manya banga chi eryo bemeranga manye see I'm not infectious anymore. Questions zange endala zabadde zakubeera nti bw'oba ng'omaze 14 days is it true that oba tokyasiiga COVID nabadde njogera ne Dr. Omu bwe yagambye So ekyo naye ndowooza okizeemu n'ogamba yes oba tokyasiga, but you can still test positive. So those are a little bit of my comments. Thank you so much.
We were new, Miss Clay. Yeah, so first off, just and I know we keep on going back to this, but the issue again for COVID, there is no cause for that. COVID is not a death sentence. COVID is no one's fault. COVID, anyone can get it. If you have it, share it with someone. By the way, just know you can catch a cough. That's as simple as it gets. No need for stigma. We should even take that word out right now to be just straight up. As far as antibodies, you're right. Yes, or developing antibodies. Unfortunately, for COVID, it's still, for now, too many for sure how long this immunity will lasting. So, maybe for some people it lasts only 3 months, and after that you can get it, or maybe it lasts longer than that. So trials are still going on. And, about the infected, by getting involved in trials that happens, we have so many going on. Or how long that immunity lasts and how strong it is. So, and thanks for mentioning that. Quite brings me back to the vaccine. Kuba question about the end. Do I really need the vaccine? The answer is yes. It's recommended that you get it only because too many how long this immunity, the natural immunity lasts. COVID is a new thing. Everything is still under trial. Some people that immunity might last for 3 months. Some of them might last for years, but we won't know until those trials have been complete, and they won't be for some time. So yes, for now they're immune. We just don't know how long that will last. And should they get the vaccine? Yes, they should, because we don't know how long their natural immunity will last. And if they get the vaccine, it won't harm them. They will just continue to be okay. As far as the 14 days, as I mentioned, is that after 14 days, you yourself, since you're immune, presumably you won't get the disease. But because someone, if they spoke close to you, or if they sneezed, the droplets might get into your nose and you have them walking around, even though you yourself won't get sick. But if you come and speak with me or get in contact with me and you sneeze, those droplets then will come from you who is immune into my nose, who is me who is not immune, then I can get the disease. So you can pass it on in that sense, which is a passive kind of passing it on, but not active that you yourself have the disease and you're passing it on. It's just that now you are a carrier. Someone else sneezed and it just, the virus found space in your nose. It's not going to affect you, not going to have any symptoms. You yourself not going to get sick. But once you sneeze, those very droplets can go into someone else, and that's someone can get sick. So that's why even after 14 days, you should continue to wear a mask such that you don't pass it on to others. Not that such that others don't pass it on to you, because you're not going to get sick, but so you don't pass it on to others. I hope that sheds some clarity.
Yeah, that's good. How safe are the masks? And also, can you talk about the masks? The side effects of the mask. Oh, okay. I'm sorry, it's okay then. That's fine.
Yeah.
They don't know. Maybe we can know.
Thank you, Mom. John.
Thank you so much.
Abaddeko naye
Mwami
kuno
Katindo,
kwali
Achaliko.
ono bamuyita Andrew Mulondo.
Yes, sir. Nsanyusa okulaba.
Nange nsanyusa okulabako ssebo. Going back with Jobado, omwami oli kye yabadde annyonnyola about the app.
Right.
App ekola in such a way nti ekunotifyinga abantu bobo oze like in contact with, oba inza kunnyonnyola kutegeeza in case oyina app nekugamba nti omanyi bw'ogenda waliwo omuntu ali ayina COVID. How does it work? According to Katindo, okusinziira nga nze mbadde mu Virginia naye kati ndi Texas sebo. Naye weba introducing app eyo ndowooza yasooka kuva mu Virginia. Yasookera ddala yali introduced e Virginia. Naye nga engeri gye yali ekolamu nga notifying abantu in case nogenda awantu oba oli mu mall ne baga nti omanyi eno area bweti mulimu omuntu ali infected oba ali positive oba ki kakati it's up to you okulaba oba weeyongerayo oba ovaayo.
Right.
That's how it used to work. Ye app gye twali tulina mu Virginia. By then, ne kati simanyi ndala we zikola. So kye mbadde njagala okumanya. Oba ekibuuzo kiri clear?
Yeah.
Yeah. Mwami John ayinza okuba nga amanyimu ku app eyo. Eyange gye na signing up in Maryland, I think what it does is that phone ye tracking wa woli omuntu yenna abadde mu eyo neighborhood bwa testing positive, then you get the message that you've been exposed. Tebaja ku any more information by who or whoever, but the app just will tell you you've been exposed. Someone that was within 6 feet or whatever distance you are has tested positive, so you've been exposed, and then you take it from there. I think different apps, but California city is so familiar how it works. Maybe more.
Yeah, California nange mpozi okwongeza katono kuba nagisayininze app. Ekintu kye tulina okumanya nti nno app tegenda kubulira nti omuntu mulwadde unless ng'omuntu oyo agenze n'atestinga, meaning that yateekayo information and that information is going to be uploaded. Besobola okugenda ku frequency abantu basobole okugifuna in that way. Naye bw'obeera nga olwadde nga tonakutestinga nga muli bataano mwenna muli balwadde, you automatically it will not notify you. Just to add on that one, that's the app. Naye nga ebisigadde byonna app ekola nga bwe mugambye, kasita omuntu abanga yatestinga before the app tells you that somebody has tested and positive, whether yesterday, 1 month ago, yekubuulira, so that you're taking more precautions.
Okay.
And I think okusinza Florence kyayogedde, I think it makes sense kubanga ne bw'oba ogenze mu ddwaliro ne bakubuuza have you tested, as long as you report your information oba whatever information you're reporting, kubanga they have to report ab'omulimu gwo, they have to report to the people you've been close with. So your information should be there okusobola okuba nti app eyo reportingira abalala, kubanga if your information is not there, how are they going to know that that person is sick? Tejja kuwulira. Omuntu oyo yennyini alina okuba nga ya reporting. So logically, if that person reported, ne bamanya nti ali positive na reporting a number, kati buli muntu anaba within the vicinity of that phone number, bajja mu notifying. I think logically that's how it works.
Yeah, that's how it works. You're right.
Yeah.
Mwami Muwanga nsanyusa okulabako ssebo.
Yes, simanyi wa.
Nsanyusa okulabako ssebo, kulikayo kako kibuli.
Kako.
Kale kulikayo kako.
Twazirundanga n'oyo mutabani wo.
Okay, kale mwebali kasita mwenera mulunda kaakati.
Oyo no mutabani wa Kabaka.
Mujjukira namulabako I think one time.
Yes, sir.
Nsanyusa okulaba Kabaka, nsanyusa okulaba.
Nange nsanyusa okulaba. Kyala Muwanga nsanyusa okulaba nange. Mwebale kuuma bulamu.
Bannange mwebale nnyo, mwebalire ddala. Ndowooza bwe waba tewakyali.
Ninayo ekibuuzo kimu.
Yenyawo.
Kati Dr. Nelson.
Wanje nnyo.
Waliwo information nnyingi oluusi abasawo ze mwerekera.
Yenyawo.
Kati bw'oba ogenda okufuna procedure from those outstanding hospitals.
Yenyawo.
They can only allow tests from particular places, tests from their places. So kati some tests wezibanga teziri good as they are supposed to be. How can a person be protected, especially if it can give you a false negative? My second question is, it is not yet clear that no, it 14 days, you could still have the virus, but they are not sure whether that you could still pass on the virus or not. And yet, after 14 days of quarantining, you can go back to work. That's where some people stand up and say, okay, if you are to work with me, kubanga now we are to emirimu over facilities. But both, they have more knowledge about the pandemic and the effect of the virus. But as the public health, some of the information that is being passed over there is not enough to protect the layman. Kubanga kati weesanga nti omuntu abadde n'obulwadde awonye ennaku ze bamuwadde eziri paid ziweddeko ayagala kuddayo ku mulimu. Yet ali safe enough. Naye kanya baga nti okay kati genda post the quarantine time, have 2 negative tests ng'omaze then olyokoddeyo. Naye kati that is where facilities are emphasizing that. Naye nga mu abantu aba public health, you are not emphasizing that. Unless nga gwe nga employer okutte essimu ate n'okubira public health, that's when you can get that kind of information. Lwaki information temuteeka out there so that people know.
Yeah, we were in that. So, yeah, idea some first again omulimo go some employment places mandating anto kubeera ne negative test. I guess Bobagala just reassuring since actually you're negative, but now with the information that just came up or that is coming up, the more we learn about the virus, the more information changes, and it changes by the day. The fact that some people bajja kusigala positive for at least 3 months, getting it before that was the recommendation, that get a negative test or get retested before you go back to work. But now, because tests going to positive until about 3 months, okugamba omuntu okufuna a confirmatory test into negative, that is really over pushing it. At least now the information we know. That used to be the case in the past. Actually, people can be positive for 3 months, but they are not really infectious. So, negative or test, a repeat test, and you still be positive. That does not necessarily mean you're going to passing on over, which is some. But really, CDC does not recommend that. CDC used to recommend it then, but not anymore. Now it just says as long as over the quarantine for 14 days, you're clean. I mean, you're clear to go back to work. And the idea with this virus is that the incubation period is about 5 days, but at least by 10 days, chances are developing antibodies, and that it's not, even though it's positive, you have the viral load is so low that you can't pass it on. So that's why after 10 days, they are comfortable to cut down the quarantine period. The more we get to know, the more that information comes up. I don't know if that made that question clear. But
not entirely. So the recommendation is whether you are positive or not, you're okay to go and work, especially at your vulnerable.
Right.
They can go and work with or without symptoms.
Right. And that's because we know that the climax of your symptoms will be probably at the 5th day. By the 10th day, your symptoms, if you still have any residual symptoms, those are just residual symptoms. The idea is it won't get worse. For the most part, for most people, it won't get any worse. So you can go back to work. Whether positive or negative, because now we know, which is what we did not know in the past, now we know for sure that some people will continue to be positive, even though they are not infectious, even though they are not going to get any worse. But because the PCR test works, that is so sensitive, it will still pick that up until up to 3 months. So unless if the company is okay with you staying home for 3 months, if you're going to be one of those who is going to be positive for 3 months, even though you're not infectious, even though you're not going to get any worse, then yeah, they can wait. But now, because of the what we know, CDC has come back to say you don't have to wait for the negative test. You don't have to retest. Once the 14 days, really they are 10 days. If you haven't had any symptoms for 10 days, then you can go back to work. But again, different companies choose what they want to do. But we know based on the biology of the virus that after 10 days, symptoms should not get worse for the many cases. But there are rare cases, of course, people end up in ICU who have severe symptoms for months. But those are really rare. But for the most of the bigger population, after 10 days, the idea is that your symptoms will not get worse.
Yeah, that is really great to know. However, a lot of anxiety, and there is a lot of the grays that are not known. Even with the CDC, by the CDC.
Right.
So what is the percentage of those few who have continued to test? Because I know you've had trials and trials are still continuing. And
Yeah.
when they posted that cutting the number of days, it was more for people to comply than to their safety. Because they say that to increase compliance, if you are exposed, we cut down the days, and if you test, and then we cut down to this number of days. Is it really definite?
No, and that's because there's still more to learn about the virus.
Yeah, that's what I'm saying.
Right.
Because the information, the public health CDC is looking into compliance.
Right.
I was part of the old school we did our research based on evidence-based research.
Right.
That's where I fall. That's why I'm asking these questions, because we've seen these things happening, and then you sit back and you give apologies. Why not play safe until you are certain? That is just my dilemma as I go through, looking at these things and not able to take chance. Even if I hear all those information, you know everything and you do everything. But that is not something where you will not stake your hand.
Exactly, and no physician or not even CDC will give you 100%. Only
that's what I'm saying. You can't stake your hand there.
Right. So I think that's why they recommend that even after 14 days, continue to wear a mask.
Yes.
And again, there are rare cases where, as I mentioned earlier, that some people symptoms go up to a month. That in rare cases, some people continue to have symptoms even after 14 days. So the idea is continue to wear a mask, continue to follow the guidelines, but at least for the majority, we know that after 14 days, or at least after 10 days, those symptoms will not get worse. At least so far the cases we have. There have been some rare cases where symptoms continue to get worse, but those are really rare. So I guess, you're right that there's so much stuff that has to go in, the comfort for those people who are under quarantine, the economy has to go on. So things are being weighed, I guess, risk and benefit. But you're right that we cannot, so far what we know about COVID, not even the vaccine, even though I say it is safe, but we don't know, everything is fluid right now. But at least so far what we know is by the end of 14 days, it's expected that, the virus has probably hit its climax, that now it can only get better. Or if you have any residual symptoms, those will just be at bay, that they won't get in the way of your work. But you should continue to wear a mask. You should continue to do the 6 feet distance.
Dr. Nelson, one more last question regarding symptoms zetwogerako oluusi z'abazungu kubanga bw'ongamba blue lips nze omuddugavu blue lips nazirabadde.
Right.
Ekyo kizibu nnyo okutegeera oba bagamba nti face bwefuuka blue kati nze mu buddugavu bwange face yange enaafuuka ekya blue. How do you guys tell a difference between a black person alina blue lips n'omweru alina blue lips? Mbadde nsawagiremu akabuuzo ako kuba nkakulu.
Yeah, no, you're right. Usually,
red.
Usually echikola blue lips, Judith, echikola blue lips is the oxygen level kubela low. So some people at home buying the oximeter, oxygen oximeter. So if you put it on and you're 90%, then you know that would correlate with that. But you're right that for a black person, toja kulaba blue lips for sure. But then that.
Otunulira ku njala, enjala zo, fingerprints. Otunulira n'eriiso lyo. Ebyo bikuwa clue. Obiraba nga bivudde ku at least regular pink nga bikaminze darker.
Right. So
bimanya. Mwabasawo mubimanya. Neze bongamba blue lips ntuna blue lips ntuna mwana wange ngamba halero banange lero bezo za blue. It's important for us to know.
Oli muto of Judas and what blood is chai mukugamba nti so omuntu alina anemia ye muntu gojja okulaba omuntu wa sickle cells oba omuntu alina anemia gojja okulaba nga amaaso ge gali pale oba enjala ze ziri pale. That I guess you could correlate that to omuntu okubanga oxygen to ali low, but usually
oxygen musawo enjala zi becoming blue.
Right. For that same reason.
Kumutugavu otunulira enjala zi becoming darker era actually n'abakadde bedda bakimanyanga ne bagamba nti unageza omutunuulira engalo zonna enjala nga ziddugadde zibikaminga blue kuba kizibu nnyo okusanga omuntu alina enjala enzirugavu.
Ogamba blue oba black?
Not necessarily gamba eyinza ate era ne mu bazungu tejja kubeera nti eringa blue nga bw'olaba blue, but it becomes darker.
Okay.
Yeah, so don't look for the color blue, look for the darker color.
Okay. Dr. Nelson, I don't know if it's okay for you to lend us that PowerPoint.
No problem at all.
I've recorded it actually.
Thank you. But
yeah, I've recorded everything.
Yeah, but we need to have it like in a document, because you know why? It could be that we want to help other people. And because I'm and I think that PowerPoint was really great. Singa msoji tuelezako in a document form, we would really appreciate. Singa cheta go kusasuranga community to ali kusasudde mwami Muwanga ekyo kiyinza okyogerako.
Ate community.
Lwaki gwogendeyo?
Zenjagala, I feel like
as your community.
Dr. Nelson.
Dr. Nelson. Community
no, honestly, the reason I'm saying that I'm appreciating it is a sign of appreciation, Nelson, because honestly, what you're giving us,
consultation.
We are so happy. You can't know how happy I am. Kale tujja tusaba n'akasituketaaga kali personal nti wema n'ekibuzo okukubira n'enkubuuza sijja kutawanya mu buddewo bwakola naye
weereze text bwafuna obudde n'akolinga back.
Yeah, I mean,
Dr. Nelson, nabadde n'ekibuuzo.
Before that, let me just ask one question. My thing is, when you get time, it would be nice for you to come and address the youth Zoom one of these days.
Yes.
I have a great group of young people who would appreciate.
I agree with you, Reverend.
Your visit. So we meet on Fridays and on Thursdays. So any Friday you ever think of a Friday where you're off, just please. You don't even, it doesn't just have to be COVID, but anything to do with life, you know. I think you'll be such a great resource to them.
Got it. I'll be on it.
Zoom, youth Zoom.
Dr. Nelson.
Akange kagambo kamu.
Julia batakabuza.
Akajja kubuuza kubanga ngenda ekyo kintu. Mukulu muganda wange Nelson nze nga sinagenda naye mbadde nsaba kwebaza nnyo olwa amagezi na message gy'otuwadde nga community naye nga sinaba kwebaza ate nsooka kwebaza muzeeyi waffe ne maama bamwami Muwanga okutukolera ettende eryo ne tuba nga mwatufunirwa omwana atuwadde ekigambo kwegamba awareness nobanga ayagaliza abantu abalala omulala ayinza okuwa information n'agisirikira naye nze mpulidde essanyu okulaba nti nno dokita tasirikidde information gy'alina naye nayagala agituwe ffenna nga community okusobola okulaba nti nno tubeerawo nga tuli balamu. Ekintu ekyo kikulu nnyo sebo taata maama ne maama mwebale kuweerera ate n'ekirala mwebale nnyo kuzaala muntu ow'obuvunaanyizibwa. Mukulu Nelson ekintu ky'okoze kino Mukama simanyi ngeri kijayinza kukuddizaawo kubanga
abalongo
obuteeyagaliza naye n'ogamba ate naawe oyambe kubanga oyambye abantu bangi nnyo naddala nze wabadde buli kaseera buli kwowulira akantu akakuluma noweegira oba toba kati covid buli kamukoga nogira era mbadde ntawanya abantu abajjuliza buli kaseera ne mugamba waayi kuba olimu obusawo kati ate kino nembuuza nembuza mama pusi ate kati kino kiki naye nze mpulidde essanyu weebale nnyo ssebo weebalire ddala era nkakasa nti nno message gy'otuweereza tekomye wano egenda kutatuleetinga ne mama musumba kyasabye tulina abavubuka bangi twabadde tusoma ku abavubuka kati bo tebeefiirayo bakola ebintu byabwe nga bwe baagala bwe bagira n'omuga togenda wa munno yaga why don't I go and visit my friend so things of that kind mbadde saba n'abaana abo nabo tuboogereko nabo reverend mukwatagane abaana abo nabo babeere sensitized naye nze nsanyuse nnyo saba weebale nnyo weebalire ddala kuwa church ne bannaffe bonna nga bwe tuweereza nze mpulira essanyu nnyo nnyo mwebalire abaweereza n'abategesi abaleese dokita ono mwebale nnyo mwebalire ddala bannange mukama abakume agende kuseeyo
kale sebo mukama kume
genda weekebeze
weekebeza dda
Auntie Gladys togwayo
obadde olina ky'obuuza
Dr. Nelson sebo nina ekibuuzo okusookera ddala nga avudde waggulu bw'ayogedde junior warden waffe mwami Edison twagala okwebaza ennyo olwa time k'otuwadde twagala okwebaza ennyo olwa information twagala okwebaza ne inspiration ky'otuwadde ffenna as a community tukwebaza nnyo n'abazadde bannange ne mwenna bagamba nti omwana akuzibwa ki abaganda bagamba batya nti omwana akuzibwa kyalo kale ne community yonna I think somehow somewhere you might have contributed okuba Dr. Nelson kyali olwaleero nga sinabuuza kibuzo kyange ekintu kye njagala okuemphasizinga video eno eri recorded byonna Dr. Nelson bya explaininze ebibuuzo byonna biri recorded making sure nti biri posted ku various chat groups and of course on the church's website zijja kubaako kubanga information eyo ebadde nnungi nnyo tetwagala ekome ku ffeffeka twagala n'abalala bagifune as first hand information ekibuuzo kyange kiri bwe kiti Dr. Nelson simanyi wakyogedde I might have missed it angana stepping away a little bit naye kyabadde nti no omuntu waba infected tugambye 7 to 10 days naba quarantined so waba quarantined for those 7 to 10 days naba nga takyali infectious after those days waddamu n'asisinkana omuntu alina covid zili the white blood cells bazikyali mu mubiri gwe eza antibodies nti no tajja kuddamu kufuna bulwadde obwo kale katugambe let me just use a weird example tayambadde mask akwataganye n'omuntu alina covid aba atya taddamu kufuna bulwadde obwo nti kubupasinga on waba insisinkane omuntu ono ali infected n'addayo awakaawe n'abupasinga on kuba awaka kyekibadde ekibuuzo kyange kyembuuza oba after an infected for 3 months ne bwasisinkana wa covid nti tabupasinga on. I'm confused about that.
Now, as far as the quarantine, nga bwe nagambye nti eyina emitendera bw'obanga obadde exposed 5 days later n'okola testing eri negative, then 7 days quarantine esobola okubaawo nga tobadde na symptoms zonna. Bw'obanga obadde exposed nota testinga 10 days ne zeerapusinga nga tobadde na any symptoms, then quarantine esobola okuggwerako awo. CDC recommends 14 days, but it can be cut down to those circumstances where obadde exposed, yes, tewekebedde naye 10 days zeerapusinze nga toyina any symptoms. I just wanted to clarify that. As far as antibodies, yes, antibodies to expecting by 10 days you've developed the antibodies, or at least by 14 days. And those antibodies are there, so chances are you won't get reinfected. There's been some rare cases where people have gotten reinfected in Ireland and Europe somewhere else, but those are really, really rare. So we believe that you are immune. How long that immunity will last, we don't know yet. So trials which are getting a mass of antibodies, how long do they last and how effective are they? But at least right after the 14 days, developing that immunity, we believe you are immune and that you won't, at least we suspect that you won't get sick again. As far as having the virus, you can still have the virus only because virus ejanga omuntu asinizinze kumpi ne woli nga toyina mask, virus neyingira mu nnyindo yo. So it can still stay there. Even though it won't affect you, even though it won't affect you, naye because you have it in the nose, bwogenda nawe no sneezing mu maaso gange, then nze atali immune, I can get that virus and I can get sick. Gwe tojja kulwala. Naye nze gweweesayiyasa no get, because the virus is at the back of your nose, I can still get the virus and I will get sick. Gwali immune you or not. So after 14 days where you won't get sick, at least the information we know now, you won't get sick. Now, if things change in the future and more trials have come up, the tumanya actually immunity lasting just a week, that will be a different scenario. But at least for now, what we know is that immunity is there and that you are safe, you're secure, you won't get sick, but you can still pass on the virus to someone else. Only because if you came into contact with someone who has the virus, they coughed, they sneezed, or they spoke, that virus found its way into your nose, you just carry it. Then you become a carrier. You carry that virus, even though it's not going to affect you because you're immune. But when you sneeze, talk, or cough in front of me, then I will pick it, but I'm not immune, so I'll get sick. That's why, even though 14 days have elapsed and you are immune, it's recommended to wear a mask so that you do not then become a carrier to infect me who is not immune. Until we get the 80% or 75% of people vaccinated. What that will mean is that even if you were to carry that virus, when you come to me, chances are I'm also immune because majority of us have been immunized or vaccinated. So in that case, then you'll be able to walk around. Still will recommend to wear a mask, but if you did not and gave me that virus, I won't get sick either because you and I are both immune. So the idea that after 75% have been vaccinated is that everywhere you go, chances are 75% of the people around you will be immune. That even if you guys passed on that virus, everyone won't get it. They will still carry the virus, but they won't get sick.
Dr. Nelson, it's good you answered that question because I had a question. My Muwanga mentioned it. Na ye achisize okay. Case whereby someone says you should be vaccinated, and they don't want to stand next to an idiot next time who wasn't vaccinated. Katato already vaccinated. Why fear to be next to an idiot who has exercised their rights? Natakiriza vaccine. Kati vaccine eyo mujesiga. Kubanga muntu ali vaccinated yabadde tatya kuyimirira nanga atali. Okujanga vaccine temujesiga. Once they use one of the idiots.
Yeah, no, you're right. And again, vaccine ain't so fast. Usually vaccines are taking about 8 years to be approved. You know, for some reason, well, understandably so, they've had approved within 8 months. So there's so many questions about it. However, method Jebako says vaccine is different than the methods that were used in the past. So because of that, and you know, data from the manufacturers, Bagamant vaccine is 95% effective. Now, question is, you and I were not involved in the trial. If it's effective for those 40,000 who are involved in the trial, how sure am I that my genetic makeup will be the same as theirs? So there are so many questions about the vaccine, and people have a reason to question whether it will be effective or not. However, right now we are going by the information we have from the FDA and CDC that this vaccine is effective and it will work. But just like they are saying that over time, FDA is going to continue to monitor to see how people respond to it. And maybe it gets to a point 5 months from now and it's not as effective as they thought, then they can recall it. Or if it gets to 5 months from now and everyone is having a bad reaction from it, then they can recall it. But until then, we won't know. So this is one of those. The reason the vaccine always takes 8 years is because then they are sure that when we put it out, we've seen the long-term effect. We've seen that it actually works for the majority. But this is a different case. They had to override. So it's an emergency use authorization that we're using now. So that's why I cannot.
Wow, it's going to kill mouth.
Dr. Linache nawulidde mu UK.
Wow.
Nti government yaweevinze abantu okusuwinga Pfizer. So nekyo nekimaking ekintu okusinga okujja kati abantu bamanya nti nobody can sue them.
Yeah.
And usually that's what happens with emergency authorization. Even the medications that we right now, like remdesivir, you know, all those are emergency authorizations. So we don't know, you can't really sue because again, it's an emergency. In emergency cases, rarely do people sue. It's an emergency. The idea is you're doing whatever you can to save a life. Otherwise, that life will be lost. So the chances of suing are minimal. However, Judith, to just finish the maybe a government will actually vaccinated the toyimirira kumpi nange. But again, you are vaccinated. Based on what we know now, they themselves should be immune.
Yes.
Naye omulala atalina mask bw'ayimirira kumpi naye nga bwe nagambye asobola okumuwa virus eyo ye n'agitwalira jjajjaawe waka atali vaccinated. Maybe that might be the concern. Otherwise, bw'abanga ali vaccinated ye nga omuntu, probably they will be protected. Naye asobola okutwala virus eyo n'agitwalira jjajjaawe oba omwana we ate ye n'afuna atali vaccinated. That might be.
Kati ye ali vaccinated obutta transmitting nga ye ayambale mask.
That's true. But also the other thing too is that vaccine again two shots, so a month apart. So we are vaccinated with just the first shot, a second, then it hasn't been tested otherwise. But at least what we know now is that just the one shot won't be able to mount the immunity that we need. So maybe it could be making that argument that if I've only gotten one shot, I haven't gotten the second one in a month. If I get near to you, I'm near you, I might get sick. Simanyu context, but maybe I'm driving abantu are getting tested. Simanyu why he brought it up that way.
No, not tested, vaccinated.
I mean vaccinated. I don't know why he brought it up that way. Besides, the vaccine, no one can mandate people to get the vaccine, only because no one is sure that this vaccine will work 100%. So, but of course, people just encourage. And besides, it is an emergency authorization that has not been proven beyond doubt. So, no one will ever force anyone to get it.
Nze ndowooza nti oyinza eggula emmotoka nga mpya byonna naye bakuwako spare tire, so oba oli vaccinated oba toli vaccinated wear a mask. Naye era nga bwe nagambye nti olulimi olubi olwo sometimes lutukola bubi ate ne lututiisa n'okututiisa idiot bankruptcy kwegamba kubanga bino biseera bya bulwadde nga bwe nagambye nti tuli mu nnaku twetaaga comforting words, not ebigambo ate bitwongera obusungu n'okutunyiiza. That's what I'm saying. Oli psychiatrist ndowooza omanyi nti n'okwogera obwogezi n'omuntu kiyinza okumuwonya. Naye ne bw'aba mulwadde nga wakuuna n'omugaa kyayi oli kisiru ani aga nti genda obbeka bakutemeko omukono guyinza okuwona naye ti ne gutawona muli ne gutawona. So omugaa okay okubba kibi naye next time oba ogize bw'oti there is a way how you can bring your point home nti omuntu ayinza okuwona ku bigambo. Of course physical ayinza okuba tawonye naye mental ayinza okuwona naye bw'okozesa olulimi olukyafu olukyamu ayinza okuwona naye ate neyeyongera n'okulwala psychologically.
No, I think it's how the information is passed on, and hopefully it's unfortunate that we have people who use any kind of language. We just don't have much control over them. They choose that and they just take it as they come.
Bannange ndowooza awamu n'ebyo tuli kumpi kumala kuba ewammwe ndowooza essaawa zigenda mu 11 naffe enjala kati etandise okutuluma.
Kale
katusabe Katimbo.
Vaccine tusooke tugirekera abazungu tusooke tukose mask tumale okulaba bana reacting.
Era vaccine tegenda kubeera available to everyone for some time. I think there's not enough supplies.
Florence is a health care. Egenda kwegerako.
Era ndi mu group eyinza okusooka ogifuna. So maybe I'll let you know when I've enkozeeko bwena nkola obubi then I'll pass that.
Nsaba togitwala kati nakulaga DNA yo.
That is then Florence wabasooka ogifuna bantu.
Katusabe Reverend Gwanya atusabire tumale asabire Katindo.
Yaddala Katindo oyo.
Yes, ma'am.
Very brilliant.
Come and protect me.
Reverend Mugwanyi olije?
Ndi aho. Sebo nsanyusa nnyo kulaba Nelson bannange. Katonda mulungi. Sebo mwaye Muwanga. Katonda atukoze bulungi.
Amen.
Mukama Katonda kitaffe Yesu Kristo tukwebaza ebigambo byonna bituwulidde okuyigirizibwa ko tusomesebwa. Tusaba Mukama wange Yesu Kristo ebigambo ebyo tubyekuume ebigambo ebyo Mukama tufunye okusomesebwa n'omuntu owaffe Mukama nkusaba kitange bibeere ng'ebigambo buli muntu abitwale nga bimufaako nnyo kubanga bivudde ku mutima omulungi ogw'essanyu Mukama era buli muntu yenna ali wano omukisa n'abantu b'omu nnyumba ye n'abantu bonna baasemberera okusobola okusharinga nabo byafunye olwaliro Yesu Kristo Mukama waffe.
Amina. Kale banaye Mukama akuwa omukisa Katindo.
Amina. Reverend katwongere kusabira oyongera okubeera obulungi.
Kale eryo eddagala lyogambye bampadde cupa 5.
Hopefully.
Baliise batya bannange?
Rwanda something.
Remdesivir.
Bambi nga tonabatugyako Reverend Sam waliwo eri ekifuba lye wayogedde waliwandiise oba waliise ki?
Nze?
No, Dr. Katimbo oba yaliise yaliwandiise
yaliwadde it's a group of medication.
There was some eroliri mu right aid oba mu CVS Robert
balita batya?
There was some I think yinza kubanga na spellings DEL YSM.
Eryo naye abaana balinywa.
Abana, it might not be good for the kids. I think ojja kukebera abaana obalina eryabwe mu cough section erinza okubeera appropriate for them for the cough.
Okay.
But
anyway, kati nga tunagenda tuwe enamba yokwa mwami wange ayinza okugaana ogituwa.
Yenjabo. Njitaddeko ku gonde.
Okay, kanjijjeko. Maama ojja jingabira. Kale nja kukukuba. Anaye mwebale nnyo Mukama bakumi. Kamalogiko pa Reverend ojjako.
Kale Julius bulungi. Tweyanza nnyo tweyanzege Reverend ne mwami Muwanga okuorganizinga gonde.
Yeah.
Amen. Mukama mwe n'abakuumi bonna.
Kale. God bless.
God bless you all. Father, as in you on this evening.